What are the top concerns of primary care provider, physician, business owners in this landscape? Would they rather be acquired by hospital systems or private equity players? Like, what does that look like for you?
I think that primary care and business owners really are very focused on trying to survive. The administrative burdens that have been posed now when you deliver healthcare is a big problem, as well as a burnout. I mentioned earlier about workforce shortage. It's a big problem for us. Many of us had to look to outsource to help deliver the care that we need, and also profitability. We are having a very difficult time trying to survive with the way the payers and what is being delivered in terms of payments. So a lot of providers and health groups and even solo physicians are looking to find a way to be acquired by hospitals or PE, private equity groups, just to help them in terms of delivering the best care possible because of these administrative burdens.
Thank you. Thank you. Now, in relation to this topic, how do you think this impacts patients and the quality of care, which, as we know, from our program, but also just from a place of values-based leadership, patients and the quality of care, that's the MVP. So how do you think this impacts patients?
This is something that is really near and dear to me. I think, when I talk to other physician leaders in the space and you talk to patients alike, where I think what really stands out is the fact that the quality of care that they feel is being delivered is not where it used to be. And this is where I think that it's really important to blend technology to care delivery in a way that will be a win-win situation for both providers and patients. So this is where I think the value proposition is in this. Finding a solution that will help decrease the administrative burdens that occur, improve quality and access for patients. And this is where if you have a solution that really meets those needs, that's really what providers are looking for. And in the short run, it seems as if it's more expensive. In the long run, it is really a solution that delivers this will lead to profitability. So it's really taking a long look aspect to it, because right now, a lot of physicians, a lot of providers in the health space are really burnt out because of all the administrative burdens that we face. And this leads to really workforce burnout. And then the quality of care delivered is less than you would want. So trying to find or use technology that will help solve these pain points is where we need to be.
Excellent. So I think you actually answered my last question, which was, how can technology help reduce the administrative burden and reduce burnout? I believe you've touched on those topics, but if you'd like to add anything else.
Oh, I would like to add a few things. First of all, I think that it's really exciting now because what we have now is Gen AI. We have these large language models. All of you have also heard about ChatGPT. I remember being in a conference in San Francisco earlier on this year, and I was able to test drive the Doximity GPT and its application in solving prior authorization problems for physicians. And I can tell you it was wonderful. Specifically, a lot of the physicians there were very excited because this is one of the pain points that we have in care delivery. So using technology to solve these administrative burdens is one way a solution can help improve the care delivery. And that will leave physicians and other health workers time to actually deliver the care that patients need. So there are so many ways in which technology can even add value, whether it's in the front end or in the back end, in terms of scheduling appointments, in terms of patient engagement. I know that Rohit, he was speaking about trying to help with care management. There are just so many ways, even in virtual care. We're all very familiar with telemedicine, whether it's in audio or in video format, with reimbursement from the government and other payers. This has really taken off. And it's just finding ways in which to improve access to care for all populations, especially those living with chronic diseases, remote patient monitoring, and chronic care management. These are all areas that really lends itself to improvements in technology and care delivery. So I'm really excited about this. And it's solutions that actually can combine both that will be the best solutions for the future. And any company that can bridge these two gaps, they are the companies that really make it for the future.